Thank you, Professor Sandra Kooij, for accepting my interview for ADHD Girls, interview with ADHD specialists for our YouTube channel. So my name is Samantha Hugh. I am the director of ADHD Girls Limited, a company with a mission to empower girls and women with ADHD through effective advocacy, communication, and specialist insights. So Professor Sandra Kooij is a psychiatrist and professor of adult ADHD at Amsterdam University Medical Center, the Netherlands. She is also the head of the Dutch Expertise Center Adult ADHD, president of the DIVA Foundation that distributes the DIVA 5 in adults in more than 25 languages, as well as the chair of the European Network Adult ADHD and the section Neurodevelopmental Disorders at EPA. So in 2002, she started a specialized department for adult patients with ADHD at PsyQ, The Hague, where she still works. Her research focuses on ADHD in women, ADHD in elderly, and on ADHD sleep and health. So I'm really excited to have Professor Sandra Kooij today to discuss the impact of hormones on women with ADHD. So Professor Kooij, we know that hormonal changes that take place in girls and women affect not just her monthly periods, but the transition during puberty, pregnancy, breastfeeding, perimenopause, and menopause. My community is interested in finding out, how do female hormones impact a woman with ADHD compared to those without ADHD?
Okay. Well, thank you for this nice introduction. I'm happy to discuss my findings from recent research. That's that we started a questionnaire study among women with ADHD about exactly those issues, namely, are hormonal mood changes more frequent in women with ADHD? And if they are more frequent, are they also more severe? And this was asked about the premenstrual week, so the fourth week of the menstrual cycle. Many women complain about their mood, their ADHD, their irritability, their aggression, and so on. And they also complained about postnatal depression. And we asked that too. And the last period is obviously the perimenopause. That is the longest difficulty because it takes 10 years to really get into menopause. And during that episode, hormonal changes are your daily bread. So that's a long period and maybe the most severe. We asked this to a few hundred women that we have seen in our department there that are officially diagnosed with ADHD. And we indeed found that the frequency of all those problems, premenstrual, postnatally, and perimenopausally, were 2 to 3 times increased compared to studies in the general population in women in general. Mm-hmm. So the prevalence of those problems is much lower in women without ADHD compared to women with ADHD. So the hypothesis was confirmed that indeed these hormonal mood changes and increased ADHD severity issues are more severe in women with ADHD, more frequent.
Mm-hmm. And you spoke about estrogen being a neurotransmitter, of the brain. So that blew my mind, because as far as we know in ADHD, that's dopamine, norepinephrine, and then the effect of serotonin. But estrogen itself regulating.
There are many compounds in the brain active, and we only know a few yet. So there's still a lot to learn, to warn you. But what's interesting indeed is that we have hormones, we have neurotransmitters in the brain, but those hormones also work on the brain and they communicate with the neurotransmitters. So it's of course, for our understanding, it's useful to talk about hormones, but their function is broader than only influencing the ovaria of the woman. They have many more functions on cognition, on memory, on mood. And these are areas that dopamine, which is the main neurotransmitter involved in ADHD, is also active in the same areas. So I found a paper in the literature that was for me enlightening as well, because for me this was new a few years ago. And I learned that estrogen acts as dopamine. and it reinforces in that way the function of dopamine. So do you have enough of dopamine and enough of estrogen? You have a good cognition, good memory, stable mood, and you can do what you want to do without too many difficulties. But when estrogen drops, and it does every month in every woman with a cycle, when estrogen drops the last week before menstruation starts, and you have ADHD, you have a generally low dopamine level. We assume, we cannot measure it in the brain, but we assume, based on all kinds of studies, that it's about dopamine and norepinephrine, which is a similar compound, that they are both reduced the whole month, of course, because it's a condition that comes with ADHD, and it's chronic, it's persisting, it starts in early childhood. So these low dopamine levels create enough symptoms on its own, like hyperactivity, impulsivity, inattentiveness, memory problems, anger outbursts, and also mood problems. So in addition, the fourth week of the cycle, everything gets more severe. The ADHD, but potentially also mood. And memory and cognition. And so people really freak out. And they call it danger week, because they can be dangerous to others. And they may feel ashamed about it. They don't dare to talk about it. But I can imagine that if you have such difficulties in the last week before the menstruation starts, you feel ashamed about your behavior afterwards, often, and then you have to apologize to your family, to your partner, to your boss, maybe. It's not easy to lose control over yourself. It's a bad experience for most people. It's not funny at all. So the severity of this hormonal changes, in especially women with ADHD, that is the group that I studied, that's something we need to pay attention to, and that we can improve, because there are medical treatments already studied, not in ADHD women, of course, but in women in general, that are effective. So that's the good news. Yeah.
And I'm seeing, the impact of hormones, right, on the women's cycle and the various life transition that she has to go through. Then it just sort of brings everything together about what we see, with women with ADHD, how we tend to have more problems with emotional regulation than men, and why some of us are diagnosed later in life and maybe in the period of perimenopause or menopause, with, our coping systems just doesn't seem to work as well, and it's really confusing.
Yes.
Do you think that hormones actually play a role in the later diagnosis of women?
Yes. Well, yes, many women may be able, not knowing about their ADHD, may be able to cope to a certain extent until perimenopause hits them.
Yeah.
Because then the symptoms get too severe to cope with. And then people say, why are you why are you coming so late for diagnosis of ADHD? Well, because it wasn't able to cope anymore with the hormonal levels that you get during perimenopause. It's at least my explanation so far. It's a hypothesis, although there is some indication in the literature that estrogen and dopamine indeed reinforce each other. And this has mainly been studied in women without ADHD. So also in women without ADHD, you can find this association with a lower cognition, more memory problems, mood changes, and anger outbursts premenstrually, especially.
Yeah, it's a shame that there's so little awareness yet about, the impact perimenopause and hormonal changes have on women with ADHD. It's definitely worth
Well,
bringing this awareness.
it's in fact quite a taboo, I think, also in women without ADHD, because we tend to see hormonal changes and pregnancy and menopause as part of the female's life, and it belongs to life issues that you sometimes have more or less difficulties with these changes, and we try not to medicate it or to medicalize it, or this is how our society often looks at these issues. But it doesn't make sense that when people are suffering from severe problems, that we still deny it. And that's where curiosity starts. So
Mm-hmm.
curiosity is always the start for new research questions. So
Mm-hmm.
what's going on? Is it indeed more frequent? Is it more severe? And does it extend to all 3 episodes in women's lives?
Mm-hmm.
My answer to this first question is yes, because we not only found a 2 to 3-fold increased rate of premenstrual issues, but also postnatal depression was around 60% that of the women told us that at least after one pregnancy they had suffered from postnatal depression. This
Mm-hmm.
is highly increased.
Mm-hmm. And yeah, in my case, it's postnatal anxiety. So along with trying to care with a newborn and new mothering duties is the anxiety of how we're going to keep them alive and how we're going to feed them. So
Yeah, anxiety and depression is one family nowadays. So we don't, regarding neurotransmitter systems,
mhm,
there's no difference.
that's right.
So the treatment is also the same.
And on the other side, earlier in life, say if a girl is going through big hormonal changes during puberty, there are many concerned parents not knowing what to do with their children who have ADHD and possibly only seeing for the first time what on earth is happening. How can they help their children with ADHD navigate this very new stage of puberty?
Well, I think puberty is a difficult episode anyway for most children and parents. It's in a way normal, but in ADHD children, it may be more severe again because all those changes of hormones and their physical changes and the need to find out who you are and what are your friends and how you want to dress and how do you want to behave and whether you're beautiful or ugly or whether you have our self-esteem or low self-esteem or even depression or whether your school is not going well, all those factors that play a role during puberty. And it's a difficult phase, I think, for all youth. And but in ADHD, when your attention is lacking and low, your memory is um, is less well, and you're restless and impulsive, you have more problems with other people, with school, with performance, with consistency and discipline. All those factors are needed when you go to school and have to finish an education. So the school episode is more difficult for children with ADHD in general. We know that from research, and there are many children that fail or that they are kicked out of school because of their behavior, or they have difficulty reading and remembering the stuff they need to learn. It's a harder life having ADHD, especially in episodes of big change, because in episodes of big change, we all need all our resources to cope. But in ADHD, the resources are less well funded or founded. I mean, so you need more support. That's not bad. It's not something that's your fault. But it is wise to acknowledge the fact that you need more support.
Mhm,
Because if you try to cope without any support, you will suffer too much. Because ADHD is difficult. It's hard to cope on your own. So you need understanding, you need support, you need to know what's going on.
mhm,
And if possible, you need to treat it if needed.
mhm. And with these teenagers or girls going into the teenage years, would you say that medication is a good place to start, or just
Well,
consulting with your psychiatrist?
yeah, the psychiatrist should decide with the parents and the girl herself. Of course, she has her own
Mhm,
opinion. But I think it's important to be well informed before you make a decision, because there are many ideas about medication, what it does and what it might imply, and whether or not the dose is right, or the timing of it, or the compound, or whatever. So you need proper information, and you need a trusted physician or psychiatrist that you can rely on. But it's good to inform yourself as well. And medication is generally highly effective. That's the good news. So it's in about 80%, the stimulant medications are highly effective. And the side effects, every medication that's active has also side effects, because those medications not only work in the brain, but also in the body. So now you understand there is no separation between mind or head and body. It's one system. So estrogen comes everywhere, including the brain, but medication that stimulates dopamine also comes into the body and may affect the bladder or the bowel or the skin or whatever organ, because it attaches to several organs. And that's how side effects basically emerge. And when you understand that, it's not so frightening anymore. It's more having a bit of understanding why and how these effects present. So of course you need to find out the right balance between the right stuff, the right dose, the right time, and the side effects level. And sometimes side effects can be managed with certain interventions, or well, it's maybe too many subjects to cover here, but I usually recommend trying medication at least. Why is that? Because you have such a high chance of efficacy, it's worthwhile. You can always decide to stop it if you don't like it, or if the side effects are too bothering. So you're the boss, and you have the freedom to choose to try at least. If you don't try, you never know.
That's right.
Yeah.
Yeah, it's very well thought of, very well thought out answer, that you gave in terms of looking into various, different management strategies, and actually being well informed enough to decide for yourself whether or not to start a medication. And if you do start, then it doesn't mean that you have to continue for the rest of your life, right?
No.
Exactly. And also, some of the women I spoke to, they said that during the week 3 and week 4 of their cycle, when they take their ADHD medication, they may as well not take it because it actually doesn't really work, So I'm just wondering, what are your thoughts in how ADHD medication work, when these
Yeah.
hormonal changes occur?
I don't think the medication no longer works in the 4th week of the cycle. When it worked in the first 3 weeks of the cycle, it will work in the 4th week of the cycle, but its effect may be diminished because estrogen is low. So estrogen and dopamine together gave a higher level of effect the whole month except the last week. The last week, estrogen drops suddenly, and this induces the complaints. And it looks as if the medication works less well, but it is due to estrogen drop. That's my hypothesis. We know that estrogen drops. That has been proven. What can we do about it? Keep estrogen stable the whole cycle, of course. How can we achieve that? By using oral contraceptives, because they reduce the swings in the hormone levels in order to prevent pregnancy. But you can use them also to keep a stable estrogen and progesterone level the whole cycle. And then you shouldn't stop the last week, because then you induce an estrogen drop again. So there's no danger in continuous intake of oral contraceptives. It's not damaging, it's not dangerous, it has no important side effects. So you can do that. That's an easy advice. You have to discuss maybe with your doctor, your GP that's prescribing the oral contraceptives, because you will be out of your medication before the end of the month, because you take it at 4 weeks instead of 3. But it's not dangerous, and you can try it out whether it helps you to keep a better mood, memory, and stable condition throughout the cycle compared to without.
Sure. And with oral contraceptive pills, would you have to look for the ones that are specifically regulating the levels of estrogen? Because there are some that, have the combination of estrogen and progesterone.
Yeah. Most pills do have a combination of estrogen and progesterone. And the newer pills nowadays, they have different levels of the hormones throughout the cycle in order to mimic a bit the natural, the natural behavior of the hormones. But for our goal, that's not necessary. We
Yeah.
want a stable estrogen level, and that for 4 weeks. So that's something to look at with the prescribing physician, which one you should have.
Mhm.
Another way to go in the premenstrual week is to increase the stimulant dosage. So estrogen drops, but you increase dopamine a bit
Right.
more than in the other weeks of the cycle when you use your normal prescribed dosage. This is not something that's been studied, but it's compatible with my theory, my hypothesis, that estrogen and dopamine, they enhance each other. And when both are low, you're stuck. You
Right.
cannot do much. But when one is low and the other is a bit higher, maybe this can compensate a bit.
Right.
It's not been studied, and it's just what experienced experts told me that they do it and that that it helps them.
Mhm.
So this is also something you should be able to try yourself. Of course, discuss it with this prescribing physician because again, you will be having finished your prescription before time when you use a bit more in the last week. So you have to talk about your physician about it and whether or not he or she agrees, because you will need an earlier prescription than normal.
Yeah,
Does
I
it
think
make
you're
sense?
you're completely right.
Yeah.
Because I've heard of some women with ADHD that I know also double up their dose the week before their period and find that it works okay. But say if they are taking that oral contraceptive, do they just take the normal dose of their stimulant at the same time?
Yes.
Okay, so it's
You can
balanced out.
combine hormones and stimulant treatment for ADHD very
Mhm.
well. I must say the treatment for perimenopausal mood problems is basically the same.
Mhm.
So you take care of your dopamine level that's low in ADHD. So you increase it using the stimulant medication. And you take care of your estrogen level that goes over 10 years down, up and
Mhm.
down until it's really low. Um, and so you use hormone replacement therapy, which is basically similar to oral contraceptives but lower dosage.
And would this work better for women who are going through perimenopause or menopause when you're having this persistent drop of estrogen?
Yeah, you should not start too late, however, because let's say when you're 70 and your perimenopausal episode is by far history, the estrogen won't be effective anymore.
Right. Gosh.
So there's a time for everything, and hormones tend to stop in the end. That's why we get menopause. Um, but if you want to continue and have a stable level, you need hormone replacement therapy, again from your GP or other prescriber or gynecologist on a stable level without any stops.
Right. Okay, that's
And
interesting.
and when you're a woman in menopause, you can use the stimulant medication still very effectively. And sometimes people also need an antidepressant.
Mhm.
So I always look what a person, what a woman needs, and whether the symptoms are more physical or more mental, or more mood-like, or more physical. When it's more physical, I would choose first for hormones. When it's the mood, you can make a decision about antidepressant therapy, SSRI, serotonergic antidepressant. They are proven effective too in studies in women without ADHD, or increasing of the stimulant dosage to be found out whether it's working
Mhm. Yeah.
to
Um.
temporarily increase, I must say. Yeah.
Yeah, that's really insightful. Thank you. And I'm sure a lot of my followers would really appreciate that piece of advice. I also have a genuine interest in how ADHD impacts the workplace. And I know that you've done so many surveys, and you've gone up on the stage and you spoke to hundreds of women. I'm just wondering, amongst your audience, were there anyone who said that maybe the impact of hormones on, impacted their work performance in their work life, especially when the women get a bit older and, the hormonal changes just became not something that they can control?
Yeah, well, I started to say during this interview that, of course, severe mood swings, dysphoria, aggression, increased impulsivity, saying things to your boss, it's not helpful usually in the workplace. And same is true for having a fight with a colleague about something that you're annoyed about, but that you are saying you're just doing it too heavy, too much. So usually you will have problems the next week or month with that colleague or the boss who are feeling a bit hurt or a bit devaluated or whatever. And then you have to apologize and to try to make it good again. And this is behavior that people with ADHD know very well, that they have made a mistake or they were late or they forgot something or they feel embarrassed about it. And they want to cope with it by showing that they're of the best intentions and that they're motivated and so on. But it's hard work every day again to compensate for all those little ADHD moments that happen in your daily life. And that's why I think you would like to be more stable, to have more control, so that this is happening less and you don't need to compensate all the time for being just yourself, which is annoying in itself, I think. So this is again a plea for stabilizing your ADHD and mood, if necessary, in order to prevent that you get exhausted of living. Is it the right saying?
Well, sometimes you can get that way. And you know what you say about being disruptive or arguing with your coworkers. A lot of the times I find, especially in women, we tend to internalize a lot of things, and we might not openly become aggressive, but internally we suffer from more of a sense of rejection because the things, just didn't work well, or we think that other people don't like us because they're not really understanding us. So, I believe that apart from stabilizing our hormonal levels, and our moods, I also believe that generally people need to understand what women with ADHD are going through. When we hit that milestone in our life where we don't have a control in how our hormonal levels are, so there needs to be advocacy as well in
Of course,
perhaps.
it all starts with advocacy, but it's hard to change the world in general. The world is so large, and of course, we all need understanding for our own issues, but there are many for many people. So it's better if you take control of yourself first.
Yeah.
It's something you can achieve. That's doable, and trying to change the world is a very big aim. Of course, we all try to change the world. I think you do this by giving organizing these interviews, and by advocacy, and it's highly, highly important. And I try it by teaching and researching and explaining and treating patients. But it's never enough to change the world, I'm afraid. So what you can change is your own coping, your own behavior, your own choices for treatment. That's what you can do to start.
Yeah. Yeah, it all starts from in the internal world, right?
Yeah, right, right.
I'm also really interested about your latest project. Would you like to maybe talk about what you're working on at the moment? What maybe people can look forward to?
Well, I want to study these hormonal issues a bit further, but so far I haven't succeeded to get a grant for it. Maybe because it's about hormones and women and cycles and stuff, and somehow it's not very well funded in general, because when you look into the literature, you find that even the normal cycle is not that well studied as you would expect. So there are many gaps in knowledge in the hormonal changes in women in general, and there are many scientific gaps in studies in women in general. So we come from far, we have to do a lot of things, and ADHD women is a special subgroup of this population. But I would love to measure the hormonal levels themselves. This is a very difficult type of study because hormonal levels are highly variable between people. And so it doesn't say much when you have a higher or lower level because the range is so broad, the normal range. So the chance that you find something that's really deviant is low. But I still want to do it because it's never been done.
Yeah.
And I will also wonder whether women with ADHD have more irregular cycles.
Yeah.
They don't use the oral contraceptives or other hormones. So they have more irregularity and maybe infertility, I'm not sure. Or maybe other disorders of the that are related to the menstrual cycle that I'm curious about. And this could be due to deviant hormonal system, but we don't know nothing about it yet.
Wow. It sounds like such an important research and, such a big research because you have to cover so many grounds and, just to find out what the baseline level is,
Yeah,
and
yeah. So I'm now cooperating with a gynecologist, and we are talking about next steps and what would be a feasible way to, maybe an indirect way to measure changes. So, for instance, we use the quantitative behavior test. That's the QB test. It measures ADHD symptoms objectively, and we want to know whether we can objectify this increased ADHD severity in the last week of the cycle. This is doable. It's an indirect way of measuring ADHD, but it's an objective task, and it will be intra-individually tested. So a woman in the first week of the cycle and in the same cycle the last week. It will be compared on the group level and also on the individual level.
And would you be looking at women who maybe suffer from premenstrual dysphoric disorder? Dysphoric disorder, right? PMDD.
Yeah. Well, this is something to be decided. We could make a choice to measure it, especially in women with PMDD, but we could also make a decision to measure it in general, because we want to know something about the whole group of ADHD women. But many of them will have more or less mood problems and symptoms in the last week. So maybe it doesn't matter, and we can use the whole group.
But it sounds really interesting. I'm looking forward to, seeing your update on it. And maybe if there's any way I can help as well, I'm happy to disseminate any surveys and anything else that you need.
Well, the survey is something else, and good that you mention it. We are planning together with ADHD Europe to send out a questionnaire on the health of women with ADHD. And it will cover hormonal changes, but it will also cover physical health, such as cardiac health, sleep, all kinds of diseases that have been found to be more frequent in ADHD, such as immunological problems, colitis ulcerosa Crohn in women, psoriasis, migraine, asthma. These are disorders, physical disorders that are more frequent in ADHD, research has shown. So we will cover all those subjects. It will be quite a large questionnaire, I'm afraid. I know people don't like it, but it's more efficient to have all this information from a very large group of women in the world. So if you're willing to distribute this questionnaire when ready, it's being in. We're making it now. It's not ready yet. I would be very grateful, because we only learn when we have large numbers of people what's really going on with the health of women with ADHD.
Yep, definitely. I'm happy to help, and I'm sure whoever's listening to this, with a actually in self-invested interest in it, would love to contribute as well towards this
Right.
this work.
Thank
Thank
you
you
very
so
much.
much. Thanks to you, Professor, for agreeing to be interviewed and also giving such important feedbacks, about ADHD, women with ADHD and hormones. I hope to speak to you again, and look forward to the update on your project.
Thank you very much for your attention and for your interest, and all the best with your beautiful website and webinars.
Thank you.
You're welcome.